The Health Department is proposing another type of polio vaccine to raise the number of children who complete their immunization schedule. Ria Fernandez has the rest of the story.
The Department of Health is studying the possibility of giving 5-in-1 polio vaccine shots to children. Under the current program, kids get the oral vaccine in 3 doses. However, on the last dose, the toddler may also get 2 injections of other vaccines. DOH told senators in a recent Senate hearing that the current immunization schedule may have led to fewer children completing their doses.
May also deter some parents to allow it because dalawang tusok po yung nangyayari and it's a bit uncomfortable already to the infant. This is a 3.5-year-old infant, ma'am, receiving 2 vaccines.
Under the government's program, toddlers should have completed all doses of vaccine by the time they reach 1 year old. But coverage for polio vaccination dropped to 66% in 2018 from 2014, 74%. The department added that the country is left behind by its neighbors when it comes to vaccination programs. The Research Institute for Tropical Medicine asserted the need to monitor people who have been vaccinated against polio. RITM discovered that the recent polio cases recorded in Lanao del Sur and Laguna were vaccine-derived. The agency explained those who have had the vaccine may have passed the virus through their stool. What happens is that in depressed areas where sanitation facilities are poor, fecal matter containing the virus may have found their way to the surface, and children who haven't been immunized to the disease may have been exposed to the virus. Oral polio vaccines are attenuated or weakened strain of the virus. Unfortunately, RITM said they've stopped monitoring those who have been vaccinated because the government slashed the 80 million peso budget tabbed for surveillance.
Mr. Chair, kinat sila ng 80 million. Sila nga naka-discover na we have this problem with polio. I know this is not a budget hearing, but since you're also the one defending the budget, baka ako nga, if you need more than 80 million, I think hahanapan namin together with my fellow senators.
Senator Risa Ontiveros advised the RITM to include in their proposal budget for manufacturing vaccines either this year or in 2021. RITM used to export vaccines, but that stopped when the facility was sold to a private developer. Senator Bongo, the chair of the Senate Committee on Health, assured the DOH that he will find ways to fund the department's immunization program. For News 5, Ria Fernandez, We Are One News.